Liam, the floor is yours.
Thank you, Lydia. I'd also like to start by acknowledging country. I'm here in Melbourne, and apologies for not being able to join you in Brisbane, but I'm here on the lands of the Wurundjeri people of the Kulin Nation. I pay my respects to elders past and present, always was, always will be Aboriginal land. I do also want to acknowledge Lydia. Not only did she come and spoke to our conference, but the great work that she and Thrive have been doing in terms of advancing this really important but quite difficult issue, in particular when it comes to sort of explaining the importance of indoor air quality. I want to talk a little bit, not just about the union's perspective on clean indoor air, but talk about it from the perspective of a rights-based framework and the important that rights are when it comes to, when we think about healthy and clean indoor air. And importantly, I want to talk about the right that every worker, not just in this country, but indeed around the world, has to a healthy and safe working environment. In 2022, the ILO added its fifth fundamental principle and right at work being the right to a healthy and safe working environment, and now sits alongside rights like protections against child labour, forced labour, but importantly for our movement, the right to organise, collectively bargain and join a union. And I think this is important because I think what often gets lost in the discussion around health and safety is actually the significant impact that it has, not just in Australia, but around the world. 3 million workers die at work every year, and in Australia, hundreds will die in workplace incidents. But what people don't realise is that more than 5,000 will actually die from work-related causes. In many cases, those are airborne causes. They are causes such as asbestos-related diseases that claim nearly 4,000 of those lives, but also increasingly issues like silicosis, which I'm going to touch on a little bit later. And actually, when we expand the numbers out even more beyond just deaths, we know that more than 100,000, in fact, close to 500,000 workers suffer ill health as a result of their work. And when we look at workers' compensation statistics, one of the fastest, indeed one of the only growing serious injuries is that of respiratory conditions. And obviously, a significant rise of that has been due to exposures to airborne contaminants like silica, but increasingly there are other issues as well at play there. And it's funny, Lydia was just talking about the challenge of bushfire smoke leading into COVID. And I think actually for our movement, indeed, I think for workers, we're in a bit of a paradigm shift when it comes to the importance of clean air, both indoor and outdoor air. And I was also reflecting on the 2019-20 summer bushfires, because what I think it did for many of us that lived on the East Coast is it really brought into sharp focus the fact that indoor air quality and outdoor air quality are significant contributors to our health. And whether it was buildings that had poor ventilation or indeed workers, so a third of workers at the time had to do some or all of their work outdoors, the importance of clean air as a workplace right was something that our movement fundamentally understood. And it was really just a few months later when COVID hit, and to Lydia's point, our responses were turned upside down in terms of how we protect workers. But what it did for us is it really brought to the fore the fact that clean indoor air is a fundamental right for all workers, and it is not something that workers share equally. It also forced us in many cases to take stronger action, and our movement was critical in terms of making sure that workplaces were safe. And important to that was ensuring that workplaces had good ventilation. One thing a lot of us health and safety fanatics talk about is the importance of a hierarchy of control. And far better than just applying masks was ensuring that we actually had good indoor air quality. And that meant that we needed to support workers who potentially were infectious to isolate. What it also meant is that we needed to ensure that workers were able to have safe air in their workplaces. And so I think when it comes to a way forward, a rights-based framework offers us a lot of hope. And indeed, in Australia, we have a work health and safety framework that has been able to adapt to a lot of emerging risks. And I think it can equally do so in relation to clean indoor air. And if we look at just the examples around silicosis of the last decade, I think there's a pretty good blueprint that we've got that we can follow. We think about silicosis, which is by no means a new disease. It's a disease that is really one of the first occupational diseases that was ever detected. But indeed, it came on in a significant wave about a decade ago with the rise of a whole heap of different work practices and indeed some dangerous new products like engineered stone, where workers were being exposed to really high levels of silica in the workplace. We saw rapidly hundreds, if not thousands of workers being diagnosed with silicosis. Got to a point where one sector, stonemasons, working with engineered stone, 1 in 4 workers that were being screened were being identified as having silicosis. But what it also prompted Australia to do is have some of the world's strongest and fastest approaches to this disease. We saw a reduction in the occupational exposure limit to silica, which was 4 times what was considered to be healthy and safe. It's still twice the healthy limit, but it is due to be reduced in the coming years. We saw, as we've all seen, the ban on engineered stone, the idea that we can replace products that are highly toxic and use safer alternatives. But what people don't realise is that we were able to put in place a pretty simple regulation that means that for the 600,000 workers that are exposed to silica in the workplace, whether they be stonemasons or tunnellers or construction workers or quarry workers, that employers had a duty to start to identify and control those risks using things like engineering controls and higher order controls. And I think this offers a great blueprint for how we might think to take clean indoor air, because the science is settled when it comes to knowing what are safe indoor air quality levels. And I think we've got a great opportunity in the tripartite approach that we've got in relation to work health and safety to adjust our framework. The framework is very good. It places duties on employers to protect workers from hazards, including airborne hazards. And it also prescribes regulations and codes of practice that set out specifically how employers, or what we call duty holders, can address those issues. And we think there's a great opportunity in relation to indoor air quality. We started to do this in relation to adapting to future pandemics and indeed dealing with the current issues in relation to COVID. We're currently in the process of negotiating a biological hazards code of practice that indeed will talk about the importance of good ventilation in terms of managing biological hazards in the workplace. It's complementary to the work that the ILO are doing right now, and it'll hopefully conclude in June next year with a biological hazards convention. So we're in the midst of great opportunity for reform in terms of workplace laws. And importantly about this is these are about creating rights for people, indeed workers, but indeed others as well that are in public buildings, to have a right to clean indoor air, because it's pretty fundamental to our lives. As I think Lydia has said before, 90% of our time is spent indoors. And that means we need to ensure that as workplaces are evolving, that indoor air quality is keeping pace with it as well. So I'd like to thank Lydia for the opportunity to be here and wish everybody the best in terms of the day's discussions. But I also want to be quite hopeful about the opportunities that we've got, not just working with our movement, but indeed across health and safety and trying to make workplaces as safe as possible for workers. Thank you.
Agenda, as I understand today, you have a full day of other engagements, so thank you for being with us today, and thank you for the support of our work. The ban on engineering stone was extremely important regulation in Australia, and it's not the whole world has this regulation in Australia. Australia really led this. So this is very important, and it's very important what Liam says is that we already have a framework for regulations in relation to workplace environment. So we perhaps don't have to reinvent everything. We should and we can build on this framework, which puts us in a very good position. So looking very much forward, Brian, to continue working with you and with your team. Thanks.